The number of daily infections in Lebanon is now into 3 digits. Officials say the coronavirus has spread across the country. They are reimposing restrictions less than a month after the country and its only public airport reopened. The numbers may be low when compared to other countries, but this is a nation of only 6 million people, including 1 million refugees, where the healthcare system is already in crisis. Private hospitals have started to turn away patients. They make up 85% of the health sector, and they are owed $1.3 billion by the government.
The health sector is passing through a critical crisis that has been going on for 2 years. We are crying for help. The health sector is taking its last breath. 10 days ago, our hospital stopped receiving non-critical cases.
Staff are also being fired. The country's leading medical facility, the American University Hospital, laid off nearly 900 nurses and administrators, citing what it called the disastrous state of the economy. Since November, up to 40% of Lebanon's 9,000 nurses have lost their jobs.
What is happening is very serious, and it's going to affect drastically the healthcare system in Lebanon. If we don't have enough nurses, this means that the number of patients who are currently at the hospital will be much higher per nurse.
Hospitals funded by the public and left underfunded and ill-equipped by successive governments for 3 decades are not just at the forefront of the battle against coronavirus.
What we have seen is, with the economical crisis, more and more patients cannot afford the private sector anymore, and they are heading towards the public sector.
Importing equipment and medicine is becoming harder and more expensive because of the sharp devaluation of the local currency and a lack of US dollars in circulation. The surge in coronavirus cases couldn't have come at a more difficult time. Lebanon is close to bankruptcy because of years of corruption, and the health sector has long been neglected by successive governments and was collapsing before the pandemic. More than 200 medical staff have now been infected. The number of patients hospitalized and admitted to intensive care more than doubled in the last 2 weeks. If that rate continues, Lebanon's hospitals, once among the best in the Middle East, will run out of the intensive care beds it needs by mid-August. Zeina, Khodr, Jazeera, Beirut.